The impression of the implant overdenture patient utilizing Aquacel Ultra and the Strong Massage DENPLANT impression tray. The viscosities used here will be the rigid, the light viscosity, and the monophase or medium viscosity. As seen here, we have a mandibular arch with 4 implant abutments. We have 3 sizes of the tray: small, medium, and large. First thing we want to do is size the tray. In this slide, what I'm showing are 2 different implant systems. We have one implant system on the top part of the slide and another implant system on the bottom portion of the slide. Each of these implant systems have different implant impression copings. Some are short, some are long. We're going to take the tray and we want to heat shape it to make sure it properly fits the arch. We can heat shape any part as previously discussed with the DENPLANT trays. This particular slide now shows both the average height impression coping as seen on the top, and on the bottom the longer type of implant impression post. The DENPLANT tray can be utilized for any height of impression post. These impression posts on the lower are approximately 10 millimeters and on the top approximately 4 millimeters. Now we want to make sure that we put the tray in and we size it and make sure it clears the impression copings, and we have space on the buccal, labial, and lingual so that the impression post generally sits approximately in the mid-center of the impression tray. Now in this particular case, we had to heat shape the tray, and we just took a micro torch and with very rapid strokes, about 5 to 10 seconds, you heat the particular area you want to reshape. What I'm showing here is reshaping both the posterior segment and the lingual segment. After any heat shaping, you must now place the tray in a bowl of cold water to re-solidify it. Make sure you don't go back into the patient's mouth until you're assured that the tray is cooled down. This particular implant case, as you may have noticed, the posterior arch is wider, and this is generally because the patient has been missing posterior teeth for a long time and the ridge has resorbed down and out, and generally you will see these cases are wider in back than in the anterior segment. Of course, we have 3 sizes of trays. However, they may not fit every single arch configuration. Therefore, these are thermoplastic and you can heat shape these. This particular slide shows that I've heated in the anterior segment, rapid strokes, 5 to 10 seconds. I then have spread it open to accommodate the wider ridge in back, put it in cool water, let it re-solidify. Once again, you should put adhesive in the tooth channel of the tray and then place the amount of rigid viscosity polyvinyl siloxane. Now here you will note that I placed more material in the posterior area. That's because it was only edentulous. In the anterior area we had the 4 implants. So in this area you should only put about a ribbon, just enough material so it will engage the top of the impression post. Now I want you to slowly place the tray in. You can use retractors to make sure that the impression post does not burn up against the tray and is approximately right in the center of the tray. You can see a little bit better from this angle. We have now placed the tray in and we're letting the stop material solidify. Once it does, we will remove it and analyze it. Take a look at the posterior part of the tray where there are no teeth, the edentulous ridge. You can see a nice little curvature here. We'll just trim the excess off, but we'll actually leave this for our posterior stop. In the anterior section, you'll see the 4 little impressions of the top of the impression copings. Now this particular area, we need to shave it down until there is no axial height of this prep. In other words, we should only have the occlusal or incisal portion that will actually touch up against the tray. As you see here, we have now trimmed the posterior area to where we have enough room for the borders, And the anterior area, we only have the 4 little stops and there are no axial heights here. Now, why don't you want anything of the axial height? Because you may not be able to get it back in when you have other material if you have to go all the way back down this inclination. Now I'm going to put adhesive around all the border areas. Once I've placed adhesive around the border areas, I'm going to put a rigid viscosity polyvinyl siloxane all around the borders and then reinsert it into the mouth and do a complete border molding procedure. The border molding procedure on the mandibular arch will take into consideration the tongue movements. We want the patient to place their tongue out, left, right. They can lick their upper lip. We're trying to capture not just the mylohyoid space, but also the retromylohyoid space. We then will hold the tray in position. We'll take our finger and thumb, pull the cheek outward. We'll then move the left and the right portions of the cheek to get the external oblique ridge, and then the anterior segment for the anterior frenum, and then have the patient pooching and smiling to now redefine the entire peripheral row. As seen here, we have our final border molding impression. And of course, some of the material has gotten around a little bit of the implant copings. That's not a problem. We'll just take a burr and reduce that. I want you to analyze this very closely to make sure that none of the tray has burnt through the impression material. This is another angle where you can see. And now we must, of course, not only trim any excess, but also any burn through the tray. This slide now shows that I have completely removed any of the burn that the impression material came off of. In other words, we trimmed the tray down. We then removed about 1 millimeter completely around the peripheral row. And then, as you can see, where there were implant copings, I wanted to make sure all I had was just a little stop. And in this case, I actually cut a little bit more, and you can see some of the clear. That's fine as long as you have your positive stop. Now we're ready to make the next impression, which is the final wash. The impression coping should be firmly placed in the mouth. We're going to put adhesive around any areas that we're concerned, especially any of the tray that's exposed. We're then going to put a light viscosity around the entire peripheral row and in the ridge area of the posterior both sides. However, where the implants are, in order for them to be picked up, we're going to put a medium viscosity into the tooth channel. Not a lot, just enough to where this material will become rigid enough and assure you and I that when we remove the impression post will be inside of the impression and not still in the mouth. Now you can see our completed wash impression. The impression copings are still firmly inside the impression. You want to test it to make sure it's completely seated prior to putting in any analogs. But take a look at the final wash. Look at the vestibular borders. Look at the integrity of the ridge. This is what we need to have anytime we have anything that has 1, 2, or 3, or 4 implants. And when we have 7 or 8 implants, many times we don't always need the entire sulcus. But in any case, whenever you're doing an overdenture, it is primary that we always get the vestibular borders and a nice integrity of the entire ridge. Here's another view, and in this case I've actually taken a little inking pen and I'm now showing you the outline of the entire vestibular border. Now it's a close-up. Look at the integrity of not only the ridge but the sulcus and the implants. This shows the cast and the tissue. These should be a replica of each other. Your final impression should reflect exactly what is in the mouth. This will eliminate most of the problems of postoperative soreness and will give you positive seating of the implant retentive elements.